Good afternoon and welcome to the City Club of Cleveland. My name is Paul Harris and I am president of the City Club's Board of Directors. I am very pleased to introduce today's speaker, Toby Cosgrove, MD, President and Chief Executive Officer of the Cleveland Clinic. In that capacity, Dr. Cosgrove presides over a $4.6 billion healthcare system comprised of the Cleveland Clinic, 9 community hospitals, 14 family health and ambulatory surgery centers, Cleveland Clinic Florida, Cleveland Clinic Toronto, and Cleveland Clinic Abu Dhabi, which is under development. I think there are more to come, which we may hear about in a bit. Under Dr. Cosgrove's leadership, the Cleveland Clinic has been ranked among the top 3 hospitals in the United States by U.S. News & World Report and has experienced improved clinical outcomes and increased patient satisfaction in addition to its expansion locally, nationally, and internationally. Dr. Cosgrove has also committed the clinic to major support for local schools, hunger centers, and high school apprenticeship programs in nursing and biological sciences. After obtaining his undergraduate degree from Williams College, Dr. Cosgrove received his medical degree from the University of Virginia School of Medicine and completed his clinical training at Massachusetts General Hospital, Boston Children's Hospital, and Brooke General Hospital in London. He served as a surgeon in the United States Air Force and as the chief of U.S. Air Force Casualty Staging Flight in Da Nang. Dr. Cosgrove was awarded the Bronze Star and the Republic of Vietnam Commendation Medal. Dr. Cosgrove, and I have to caution you here, there are lots of numbers here, so I'll try to follow this. He's published nearly 450 journal articles, book chapters, 17 training and continuing medical education films, and 1 book. Before retiring from surgery in 2006, Dr. Cosgrove performed over 22,000 operations and earned an international reputation for expertise in all areas of cardiac surgery, especially valve repair. A pioneer and refiner of advanced surgical techniques, Dr. Cosgrove was a pace setter in the development of minimally invasive valve surgery and performed the first such procedure over a worldwide video network in 1996. Dr. Cosgrove has 30 patents filed for developing medical and clinical products used in surgical environments. Dr. Cosgrove is a member of 16 scientific societies, including the Society of Thoracic Surgeons, the American College of Surgeons, the American Heart Association, and the American Association of Thoracic Surgery, for which he served as president in 2000. Among his many honors, he is a member of the Cleveland Medical Hall of Fame and Cleveland Business Hall of Fame. In 2007 was named Castle Connolly's National Physician of the Year and is a recipient of the Woodrow Wilson Center Award for Public Service. I am pleased and honored to present on behalf of the City Club of Cleveland, Toby Cosgrove, MD, President and Chief Executive Officer of the Cleveland Clinic.
Thank you, Paul, and good afternoon. It's an honor to be invited here today to speak. The City Club Forum has always been an outstanding platform for the discussion of important issues. In the 5th century BC, Heraclitus observed, "Nothing is permanent but change." Healthcare is changing. I'd like to briefly outline these changes and discuss the effect on patients, diseases, treatments, the delivery system, caregivers, and finally costs. Healthcare and the economy are in the midst of a historic realignment. The Cleveland Clinic needs to innovate and evolve if we are to continue to serve patients and remain an economic engine for this region. Let me begin with a look at the dramatic changes in our own community. The city of Cleveland has shrunk dramatically over the last 60 years. The population has fallen from 900,000 to less than 400,000. Cuyahoga County has seen a similar but less dramatic change. The population has dropped from 1.7 million to less than 1.3 million. We're treating different mix of diseases today than in the past. Infant mortality has reduced 95%. Devastating infectious diseases like tuberculosis and polio have been virtually eliminated. Life expectancy has gone up to 78 years. We're seeing more patients who are 65 and older. This population is set to explode to more than 50 million people over the next 10 years. As life expectancy goes up, the causes of disease and death are changing. In 1960, chronic diseases were 3 of the 6 major causes of death in the United States. Today, they are 6 of the 7 major causes of death. Alzheimer's disease is now more common than diabetes as a cause of death. There are 5 million cases today in the United States. That number will triple by 2050. The epidemic of obesity that began to sweep across the United States in 1980 continues. 20 years ago, no state had more than 15% obesity. Today, no state has less than 15% obesity. 30% of the United States is not simply overweight, it is obese. Ohio is the 15th most obese state in the nation. This condition increases the rate of diabetes, heart disease, high blood pressure, and joint problems. Isn't it ironic that we could wipe out the recent longevity changes with obesity, and our children may not live as long as we did? We've seen radical changes in medical technology. The new treatments are staggeringly sophisticated and remarkably successful. Those of us in the medical profession are startled by this new technology, which is increasingly aimed at older patients and those with chronic diseases. Joint replacement used to be rare and risky. Today it is safe and common and done 1.6 million times a year. Organ transplantation was unknown in 1960. Today is a daily, and my cardiac surgeons tell me, a nightly occurrence. More than 72,000 Americans had tissue transplants in 2009. We're exploring the frontiers of neurosurgery. Deep brain stimulation is being used to treat neurodegenerative diseases like Parkinson's and behavioral disorders like depression and drug addiction. 30% of the premature deaths are related to genetics. On the horizon is genomic medicine with a vast potential for prediction and prevention. Cleveland Clinic serves this community through 9 regional hospitals. These hospitals include some of the oldest medical facilities in Cleveland. They are profoundly affected by changes in population and technology. Many of our regional hospitals are aging out of their usefulness. Some of the operating rooms are too small for modern surgical equipment and need to be modernized to current standards. Some of the patient amenities are substandard. Hospitals have historically moved to follow the population. The founders of the Cleveland Clinic moved their medical offices from downtown to 93rd Street and Euclid Avenue in 1921. Glenville Hospital moved to become Euclid Hospital in 1952. Doctors Hospital moved to become Hillcrest Hospital in 1968. The changing demographics have caused 50 Cleveland Catholic churches to close. 66 Cleveland schools were closed. Hospitals have responded in a similar fashion. Since 1970, 14 hospitals have closed or merged. But hospitals have seen more drastic changes than churches or schools. The average hospital stay has been reduced by 3 days. New techniques have transformed surgery. The majority of all surgeries are now ambulatory. More patients are being treated at home. Over the past decade, Medicare home care costs have doubled to $18 billion. Doctors' offices have seen a revolution over the past quarter century. Outpatient visits have grown 200%. The center of gravity is shifting away from the hospital.